internal medicine training is specified into um, two broad categories. You've got your Group 1 specialties, and these are, we're going to go through a list of these specialties, but these are the major medical specialties. So looking at the structure overall, you need 2 years of foundation training, right? So in the UK, that's your FY1 and FY2 years after finishing medical school. Then you would be applying for internal medicine training towards the so in October of your FY2 year, you're going to be applying for IMT. If you are an international doctor, then you would have had this foundation training. You might have had this foundation training abroad when you got your full registration in the UK. You need an extra step as an international. You need a crest form to be signed. A lot of people join the NHS in a non-training post, where they spend 6 months or a year in that post and then get their crest form, which is basically the form indicating your competency to enter core training, saying that you are as competent as as someone who's done their foundation training in the UK. Now, some people get this crest form signed from abroad as well. If you have, you would need a consultant that's got a GMC register and can certify to the points on the form. But anyways, that's a topic for another video. My main point is that it's similar. If you're international or you've done your medical school and foundation in the UK, the only extra thing you have to do is to have a crest form if you're an international. So for Group 1 specialties, it's 3 years of internal medicine. So 2 years foundation, 3 years of internal medicine training, and then during those 3 years, you need to get your full MRCP. So that's your Part 1 and Part 2 and PACES, and then you apply for higher specialty trainings. So Group 1 specialties require you to do 3 years of internal medicine, and that includes your third year is going to be a registrar. So you do 2 years as a medical SHO and 1 year as a medical registrar. Then you apply for higher specialty training, which is usually 4 years. During those 4 years, you do one more exam. I know it's a lot of exams, but the bulk of it is during your internal medicine training. You do 3 exams, Part 1, Part 2 MRCP and PACES, and during your higher specialty training, you do your SCEs, which is specialty specific, and it's 1 exam. Anyway, so this is for your Group 1 specialties. For your Group 2 specialties, this is similar, but instead of doing 3 years of internal medicine, you only need to do 2 years of internal medicine. So this is a deal breaker for a lot of people, because you don't need to work as a medical registrar if you go for Group 2 specialties. But you also only get 1 CCT, meaning that when you finish your whole of your training, your internal medicine training and your higher specialty training, you only get one specialty. So if you do hematology, for example, you're a hematology consultant. Wherein if you do Group 1 specialties, if you do, for example, cardiology, when you finish everything, you're a cardiology consultant and a general internal medicine consultant. So we call those dual CCTs. So you finish your training with 2 CCTs, one in general medicine and one in cardiology, for example. And you can work in both of those specialties. So that gives you a bit more of job opportunities and a bit more. Generally, you can choose to work either in your specialty of choice, or you can choose to work as a general internal medicine specialist. Okay, Now going through the specialties then, what are the specialties? For Group 1 specialties, these are most of the major medical specialties. So acute medicine, cardiology, clinical pharmacology and therapeutics, endocrine, gastro, neurology, renal medicine, resp, rheumatology. So you can see a full list here on the screen. Um, but but yeah, so most of your I would say the common medical specialties that people want are in Group 1. So this going into one of these means that you do 3 years in internal medicine, um, where you do 2 years as an SHO and one as a medical registrar, and then you do a further 4 or sometimes 5 years, depending on the specialty in this higher specialty training. Okay, so these are the Group 1 specialties, and the Group 2 specialties are a bit more niche. They're specialties that don't involve a lot of general medicine. And for these specialties, you don't need to work as a medical registrar. So this is a full list here again on the screen. I'm not going to go through all of them, but things like I mean, favorite specialties here would be things like clinical genetics, clinical neurophysiology, dermatology, hematology, immunology, infectious diseases, medical oncology, nuclear medicine. Um, so these you can do as a Group 2 specialty with only 2 years in internal medicine. Um, you can also recently, now these are all from the Royal College websites. I've put the resources in the description if you wanted to check them out. Um, Now, trainees, internal medicine trainees, are also able to apply for intensive care medicine after doing 2 years of IMC. So that's also an option if you want to do ITU work. Then you can also go through the IMT route. Okay, so that was just a general overview of how the structure works. Now, if you are going to apply, when are the dates that the vacancies are opened? So the applications open on the 24th of October, as you can see on the screen, and they close on the 21st of November. So this is for 2025 recruitment. So this is already passed. So, but for 2025, it's going to be the same. So you're going to apply in 2025 to start in August 2026, right? So if you're thinking of next year, this is to prepare from now for next year. So you'll be starting August 2026. You'll be applying in by November 21st of November 2025. All right, so that's the closing date. Then long listing is confirmed on the 17th of December, and then the short listing is where basically you're invited to interview. So it's two parts. This is what I want to explain here. There is an application scoring just based off of your competencies. For example, we're going to go through the whole matrix, but your research, your publications, your presentations, your teaching experience, all of that, and it gives you a score. And that score needs to be high enough to get you shortlisted for an interview. Okay? So the first step is, and what we're going to focus on here is preparing from now to get to that interview stage. And I'm not talking about the interview stage in this video. This video is solely for preparing from now. Prepare your CV, prepare your application so that you do get the opportunity to make it to the interview phase. Okay, so this is it. You apply. They close by the 21st of November, and then by the mid-December, you know whether you've met the cutoff and you've been invited to the interview or not. And then you book your interview, and the interviews are held between January and February, and the rankings are released end of February, and the offers are made mid-March. Okay, so just a general overview of the timeline. Any questions up till now, guys? And If any of you have any questions at any point, please put them in the comment section below, and I'll have a look. Let's have a look now. Right, so there is a yeah, it's good. There's a few comments saying that you can see the screen. That's great. There's a comment from Penny P, saying when is the best time to start preparing different components of the application? So that's a great question. So actually, that's why I wanted to make this video now, because I think this time now is great to start preparing, because from March, if you prepare until November, I think you've got 6 months, and most of these things you can do. Maybe, well, maybe not the postgraduate degrees, maybe not, and the publications you could if you really tried, but all of the others you could sort out in 6 months. So it's a great time to start now. I would say from February or March, start preparing. Um, so let's have a look at the competition ratios. Now, this is a bit disappointing when you look at it. It's getting into training has become very competitive. Unfortunately, it's much more competitive than it used to be, and that's why it's very important to prepare your CV, to prepare your application, and get you those points that you need. Um, so that's why it's getting more competitive. So let's go through the application scoring matrix to make sure you maximize your chances. It's the competition ratio for 2024 was 3.669, but you got to remember one thing. Don't let these competition ratios put you off, because you got to remember that people apply for a lot of different specialties, especially something like internal medicine, where it's not everyone's first choice. So someone might be interested in radiology, but they also apply for internal medicine in case they don't get into radiology, for example. So a lot of these are from people that apply for multiple specialties, and it's not necessarily a true representation of the competition ratios. I mean, and what I'm trying to say is everyone that applies doesn't necessarily apply with the intention of solely just doing medicine. So do your best, prepare your CV from now, and there is a good chance you will get in if you try hard for it. Let's see if there's any questions. There is a question from NTGNO1. Says, what are the most common mistakes people make during the application process, and how can we avoid them? We're actually we'll go through what is very important to do preparing, and then once we go through this, we could come back to what are some mistakes, and while we go through these, I'll try and highlight some mistakes to avoid in the process. So let's look at this. This is the scoring matrix. So you basically get scored on these parameters. These are some changes that have been done in 2025. Now, it used to be you could score up to 40 points in 2024. That changed, and the maximum you can get for internal medicine training now is 30 points. Some of these things, such as additional achievements, that's been scrapped. What else has changed? Presentation used to be a maximum of 7 points, now it's maximum 6 points. Publications hasn't changed. Teaching experience, max points was 6, now it's 5. Training in teaching hasn't changed. Quality improvement, max points were 5, now it's 4. Leadership and management, this is a big one that's changed. It used to give you up to 4 points. If you, for example, was for example, when I was applying, I used to be editor-in-chief and founder of a newspaper, of a medical newspaper, when I was in medical school, and I used that, and it did get me some points on leadership. Other things like being in the trade unions or being reps at your hospital used to get you points, but they don't anymore, unfortunately, which is unfortunate, but it's something that's recently changed. MRCP makes no difference for IMT. That's why you see 30, 38, 40, 48. It gives you 8 points for higher specialty training, but for internal medicine, it doesn't give you anything. So if you want to do it before you do IMT, I would very highly recommend it. If you're sure you want to do internal medicine, then definitely do your MRCPs, but it doesn't get you any points. It might show some interest to specialty, especially in interviews, but it's not going to get you any points for application, unfortunately. Um, before I move on, let me just check the comment sections. There is another comment from Penny. It says, to add on the questions, can you clarify how the self-assessment scores are verified during the application process? That's a good question. Um, I'm not 100% sure on this, but when I was applying, I looked this up because it's interesting because you self-assess yourself basically. You give yourself the points in each domains and you submit it. And they don't. When I applied, and that was in 2022. I don't know if it's still the same, but they wouldn't ask for evidence. You didn't even have to upload the evidence. But I do know that it gets audited. So sometimes some people randomly are chosen and they would audit and ask for evidence in each domain. And if you're lacking any evidence for those, then your score would be decreased. And then if they're thinking there might be an element of intentionally trying to overclaim, and if it's an issue of dishonesty, then you might get in trouble for it as well. So it's a good idea to stay as honest as completely honest in this process. But it is a self-assessment. Yeah. Okay. Other question: is there any way to strengthen applications if you lack a publication? Yes. So if you see publication gives you 8 points, which is a lot. It's more than any other domain, but it's not the only. It's not the only domain. You either have it or you don't, really, with publications, and you can work on it from now in 6 months to get something published. Something like a case report is not that difficult to get published, but others might be more difficult. But there are other ways. Another thing. Now let's start going through each of these in details. Postgraduate degrees and qualifications. This is also a bit like the research, just a bit even more difficult. There's no point me going through details of this. You either have this or you don't, right? If you have a PhD or MD by research, it gives you 4 points. Masters gives you 3. Um, Other postgrad diplomas gives you 1. I think like something like PG Cert, which would give you a 1 point. But yeah, so you either have this or you don't. So let's carry on. Now the next thing I wanna discuss is presentation and posters. Now this is something that you can actually achieve in a short time. And from now, if you have especially if you have a specialty that you like, or whatever you can, if it's solely to get points for your application, find something you can present. Right. So if you've done an audit or a quality improvement project, and you want to publish it and present it somewhere, if you've got a case report in any specialty, then look up. For example, you've got a endocrine case report. Look for societies for endocrinology in the UK. For example, a British Endocrine Society, and see when they're doing their next conference. And you can submit your abstract and get either an oral presentation or a poster presentation in those conferences. They're not very difficult to get. It's not very difficult to get in, especially if it's good quality work. They're constantly looking for people to present. The more people submit, the more money they make as well in the process. So as long as it's quality work, you can easily get an oral or a poster presentation. An oral presentation is the better option. If you're the first or second author, it gives you 6 points. If it's a poster, it gives you 4. If it's an oral presentation in a regional meeting, not a national or international one, then it gives you 3. A national or international means that open to everyone in the country or to internationally. A lot of the bigger societies hold international conferences. It doesn't mean that you have to go to another country for it. It means that it was open to other countries. Um, and so if it's a regional, for example, if in your region, for example, if you're training in the East Midlands and it's for example there is a regional meeting for all of the East Midlands trainees and you present there, then that would be a regional presentation. If it's an oral presentation at a local medical meeting, for example, for example present a case in your grand rounds, then it would give you 2 points. But I think you can get the top marks. You could get the 4 or the 6 if you start preparing something from now. I think I had 2 points when I applied for my IMT, but I've since then I've done a poster presentation for my higher specialty training, and I can get 4 points for that. So yeah, you could get 4 or 6 points in this domain if you start working on it from now. Let's see if there's any questions. How do you NTGN01? The question, how do you recommend finding a supervisor for UK-based projects as an IMG? It depends on if you're working in the UK, in the NHS, then you would find plenty of supporting consultants that would supervise your projects, your quality improvement projects, for example. And then we'll talk more about it when we go on to quality improvement projects. But yes, that's it for your presentation and posters. So aim to get either a poster or an oral presentation at a national or international conference. Publications, again, this if you have one or more original research that's PubMed cited, you get 8 points if you're the first author. If you're the co-author, you get 6 points. If you're the first author, joint first author, or corresponding author, or co-author of more than one PubMed cited publication, that's not original research. This could be things like editorials, reviews, case reports, letters, and that gets you 5 points. So see, this is not, I think this one, even if you don't have that original research, I know that for some people, especially those that don't work in big teaching hospitals, it might be difficult to get publications of that magnitude. But you could see if there was any, for example, any meta-analysis is going on that you could join on that could qualify as an original research. But if not, you could try and publish, for example, 2 case reports. And if you do, and it is doable. If you start from now, look for interesting cases in the hospital, go around, ask the registrar, say, listen, if you have anything interesting, let me know. I'll do the grunt work, I'll do the paperwork, I'll do all the boring stuff, to get you these points. If you get 2 case reports published, where you're the joint first author, corresponding author, or co-author, that's easily doable if you work hard for it. Then yeah, that would give you 5 points. If you've written a chapter of a book that's related to medicine, let's give you 5 points. If you only have one PubMed cited other publication, like say for example a case report, then that gives you 3 points only. And then if you've published anything that's not PubMed cited, then gives you 1 point. All right. So this is good to work on, but don't stress too much about it, especially if you work at a small DGH and you think this is not very possible. Then you can ignore this for now. Try and get a case report or 2 in if you can. If you have the facilities and you work at a big hospital, then go for an original research. Next, we'll talk about teaching experience. So this is something that you can do in a short time frame. Going to the questions, question from Dr. Bob: what types of projects are best ones to do in a short time frame? So as I said, you could work on a case report. Even if you get one case report published in 6 months, that gives you 3 points. If you get two, that gives you 5 points. Doable. Presentation: the same case report that you publish, you can also apply an abstract at a conference and present it as an oral presentation, and that gives you both. It gives you points in your presentation and it gives you points in your publications. Right, so that's an idea. This is also another thing you could do in a short time frame: a teaching experience. Now, if you organize a teaching program over 3 months or more, where you regularly teach and you get some evidence of feedback, that could give you the maximum 5 points. So, for example, you have for example, departmental teaching wherever you work once a week. If you're rotating in that specialty for 4 months, talk to your supervisor before it starts. Talk to whoever's organizing the teaching. Say, listen, I have an idea for this. For example, I want to focus this 4 months course on, for example, common medical emergencies, right? Um, and organize topics, pick topics, for example, and then get people to help teaching, and you teach yourself as well. For example, teach once a month or twice a month, over 3-4 months. And if you do that, if you organize the teaching, if you organize the program, and you contribute yourself to teaching, then you could get 5 points for that. If you regularly teach but don't organize the teaching yourself, it could give you 3 points. And then if you just occasionally have taught and you've got some feedback, that would give you 1 point. But this is an easy 5. Spend some time, organize some teaching in one of your rotations, organize the teaching, teach yourself, get feedback on every teaching that you do, and you can get these 5 points. Training and teaching is another domain. The maximum you can get in training and teaching is 3 points. If you have a higher qualification in teaching, such as a PG cert, this gives you 3 points. If you have something below a PG cert, then that gives you 1 point. So this is things like, I personally did the Teach the Teacher course, and that's like the one I did was an online one, but it takes around like 12 hours or something to finish the whole thing. But that gives you 1 point. And it's actually good. It's good experience as well. It teaches you some common new teaching and methods and pedagogy, and it's good. If you have a PG cert, then that's even greater. Then it's even better. I know from friends that some people who do like teaching fellow jobs, sometimes it comes with a PG cert. So if you are in a position to do a job like that and get a PG cert while you're doing the job, then that's great. This would give you 3 points for IMT and then 4 specialty training as well. I said something about PG certs giving you maybe points in postgrad degrees. I'm not sure about that, to be honest with you, but it definitely gives you 3 points here in the training and teaching. Okay, let's see questions. NTGNO1 asks, who is best to provide letters of contributions? I think your medical education department. I got mine from them. I was organizing teaching for undergrads. I chose a few topics and then I regularly taught over the course of 4 or 5 months. And I got them to write me a letter saying that I organized the teaching and helped get people to teach and to teach myself as well. I think that's one. You could also get something from your educational or clinical supervisor. If you supervise the teaching, for example, in a rotation, then you can get them to write you a letter about your contribution. Are online feedback forms acceptable evidence? Yes, yes, it is. There is one by the Royal College. You could, if you Google it, Royal College teaching feedback forms. There is one approved by the Royal College as well that you could use. And on ePortfolio, um, if you're using ePortfolio, there is a developing the clinical teacher slash teaching observation form on there that you can also use. All right. Um, going on. Um, going on. We are gonna um, have a brief chat about quality improvement as well. Um, okay, so there's been a bit of a change in this as well, where the maximum you could get was 5 points. Now it's only 4 points. If you're involved in all stages of two two cycles of a quality improvement project, that gives you 4 points. This is another thing that you could do in a short time. So choose something that's easily achievable, right? For example, I'll just give some common examples, right? For example, you do something like antibiotic. For example, are antibiotics prescribed in the correct manner in the hospital, right? Is a dose clearly written? Is a name clear? Is the indication written? Is a duration written, right? And you do one cycle where you collect data. You look at 100 medication charts and see how many are prescribed correctly. You identify, for example, that overall 80% of them are not ideal, or 70% is not the standard it should be. That's your first cycle. Then you recommend a change, right? You recommend a change, something that's doable, that's actionable, um, and then you recommend a change, and after that, after recommending that change, then you do a second cycle where you see if there has been a change or not. And you can use this if you've done both of these cycles. Then you can use this as being involved in all stages of a two-stage quality improvement project. For internal medicine, you don't have to personally lead the quality improvement project. For higher specialty training, you do, but you can lead one of your own if you want. To be honest with you, this is a good experience one, and also it's not it's not a difficult thing to do. Um, if you're involved in some stages of two cycles, then it gives you 3 points. Um, the stages, we mean things like planning, data collection, data analysis, and implementing change. If you're involved in some parts of both cycles, then you get 3 points. If you're involved in some stages of only one cycle, you get 1 point. Again, this is something you can do. Um, you can get 4 points if you put in the time. Let me see if there's any more questions. There was questions from Butte90 asking what was the most challenging part of applying for training. I think for me personally, I started working in the NHS in February, and I applied to training as a trust grade in medicine, and I applied in November of the same year. So that's why I wanted to do this video at this time, because I really started preparing myself around March, April time, because it took me a few months to get used to the system and just get my head around what was going on. But from April or so, I started preparing, and I prepared most of my stuff in those 6 months, and that's why I wanted to share that experience with you. Um, it's doable. I didn't have many of these, so from these, um, I did a two-cycle quality improvement project. I organized a teaching program, so I got maximum points in those two domains. I did a teach the teacher course that gave me 1 point for that. Leadership used to give 3 points, so I used my in fact I was editor in chief of that newspaper and I founded a medical school, and that gave me 3 points. Um, so so a lot of these things you can do. I did an oral presentation at the hospital. I didn't have, because I didn't have any of these. I couldn't do more than that in that life in that time span. I just did an oral presentation at my local hospital, and that gave me 2 points. But that presentation was actually for one of the audits. So you can combine these. There's no problem in combining this. For example, your quality improvement project, you do one cycle and you present it at your hospital, that gives you 2 points. Or you do both stages and you apply, for example, you want to do an oral presentation at an international conference um, about about your quality improvement project. And that gives you full marks for your presentation, and it gets you full marks for your quality improvement as well. So there's no problem combining these different domains. Um, okay. Question from Penny P. Do we need to implement change in order to get full marks for the quality improvement section? Yes. Um, yes, you actually do. Let me just have a read through this. Yes, so it clearly says involvement in a project where a change, act, or action step has not been carried out, but only suggestion for change does not constitute involvement in all stages. So you need to demonstrate that some change did happen. It doesn't have to be a massive change, but for example, you could say, all right, so we introduced, for example, antibiotic prescription was not great, so we introduced this new, for example, pop-up alert that pops up whenever you're prescribing it. Pop-up comes up telling you, remember to do this, this, and that. And then you re-audit it in 2, 3 months, and you see that actually it's gotten better by 2%. That's great, you've done a change. Even if it doesn't change, and you audit it, and you're like, well, we tried this, it didn't work. You implemented a change, and the change didn't work. That will get you maximum points. It doesn't necessarily mean that you must have made a massive change. It means that you did a change. It doesn't necessarily need to have data supporting that it was a very positive change. So, but there has to be some plan, right? All right. Cheers. Thank you. All right. Yeah. Well, that's it. I think we've gone through most of the domains. Um, for from research to publications to teaching and then training and teaching, quality improvement. We've gone through what can get you points on your internal medicine training application. Um, Please feel free to put any questions in the comment section, and I'll be more than happy to answer. Um, but I'll just like to say that start preparing from now. It's very important to take 6, 7 months to prepare well and look at what is going to get you points on your application, and only do that. If you want to score high on these applications and your goal is to get into internal medicine training, then see what gets you points and focus your time this next 6, 7 months on just doing that. Okay, because the cutoff point I remember for last year from friends and stuff, I've heard that it's been around 15. So you needed 15 points to um, to get shortlisted to interview. And if you don't get enough points to get shortlisted to interview, then you can't, even if you have excellent interview skills, you can't get to the interview phase. And I don't want to talk about the interview in this video, but the interview is most of your ranking and the fact that you're going to get in or not is based on the interview. But this application is very important to score high enough to get to the interview. There's a question from Dr. Bob. What are the most overlooked areas where candidates can gain easy points. I think the easy points, in my opinion, are the training and teaching. That's an easy 1 point. If you want, you do the online train the teach the teacher course. That gives you 1 point. That's quite easy. Organizing a teaching program and teaching on it for 3 months is also doable. And getting a 2 cycle quality improvement project is very doable. So those three are very doable. And the presentation, definitely get something. You getting 2 points for an oral presentation at your own hospital is very easy, but I think you could do better. Getting a poster presentation or an oral presentation in an international conference, I think is also very doable. So yeah, those I think are you can focus on. One more question from Penny P. For international medical graduates, what additional considerations should be taken into account? The CREST form is important, as I mentioned. You need to get your CREST form signed before you can apply for core training. But if you spend 6 months or so working at a hospital, then and if you demonstrate the skills that's on the CREST form, and your supervisor sees you uh, doing those skills, then it's doable to get the CREST form signed off. I think that's one difference. Um, and you should also take it up into consideration that it's a bit more difficult for international doctors, because sometimes students, especially if they've been in the system since medical school, they might have started working on a few of these when they were in medical school. Right, so there's one last one. I promise. That's all right. I mean, that's why I'm here to hopefully help with answer these questions. Are there any free or low cost resources you'd recommend um, for preparation? Um, to be honest with you, most of these don't really need much money. Like preparing your course is completely free. Quality improvement, that's free. If you want to submit your abstracts for conferences and stuff, that might cost you a bit, maybe £50 or £80 or whatever it is. If you submit to a journal to get published, that would, again, 50, £80. Um, but for the training and teaching course, if you want to do the teach the teacher course, um, there is one by, I mean, I'm not sponsored by any of them, but this is just my own experience. I know that Oxford one is quite expensive. I think at that time it was like 500, £600. I found another one called, I think it was called Erudical, Erudical. You could Google it. They do the same course. It's like a budget version of it, and that was like £140 or something. So I think that's a cost-cutting thing you could do if you wanted to spend less money. All right. Okay, guys, I'm going to wrap up. I hope this was useful, and hopefully we'll do more of these live streams. I apologize for the technical issue in the beginning. This is my first live stream, so I didn't know what I was doing. Alrighty. Have a good day, guys, and thank you for listening.